Hello, this is Stephanie Rojas with the University of New England, and today we'd like to address the Health Board on a database that we have created that could potentially be used for your diabetic registry. And we will be able to show you some of the information that you'll be able to pull for your patients and their information that can be loaded into your system electronically. So the purpose of this database is to develop a registry to address the problem we have with diabetic patients in our community. The database will allow for data aggregation that can push us towards future research and discovery of the patient population around us. It will also provide you with the snapshot of diabetic patients, whether they're progressing or declining in their health and their diabetic control. Some of those things that we can offer you and give detailed information on is the patient's glycemic control, any coronary risk factors, and we'll talk about the labs that we can look at in a little bit, and then also any developing microvascular kidney disease that may be coming upon them. So first we want to kind of break down the information that we're going to store in the database. And the first is, again, demographic table to be able to capture the patient's first name, middle initial, last name, and suffix if they have one, so that we can identify our patient population out there by name. The date of birth, we can also use that to calculate the patient age. And then if there's any differing age groups out there, so the under 18, between 18 and 30 and higher, and then the elderly population. And then, of course, the street address with city, state, and zip, to look at the geographical location of our diabetic patients and determine the community outreach that's needed with trended data by area. The home and cell phone numbers, once we identify those patients that are going to need some outreach and further education, we can speak to them directly and communicate with them that way. The diabetes type will also be helpful to target those that have insulin dependence and have for a long time, and then also the gender to kind of break down the information and tailor the education as far as nutritional needs and so on to view those trends. So the next table that we have are our lab results. So we're going to get that hemoglobin A1C to be able to determine the glycemic control and how we can further identify those patients who are going to need more education in controlling their diabetes by getting their hemoglobin A1C numbers lower. Next is the creatinine that we're able to look at. It does also identify which physicians are ordering the test and then what their creatinine values are so that we can take a look at their microvascular kidney disease. Last on the lab result table is the LDL, so we can look at their coronary artery risk and the values that have been recorded from laboratory results for that patient. The next table are the vital signs table. We know which date the vital signs were documented, and there's also some other helpful vital sign readings that we'll have, such as systolic, diastolic blood pressure, what the patient's height is in inches, and weight in pounds, and their body mass index. And this information will be really helpful for those that have a higher BMI, poor glycemic control, so that we have lots of possibilities here to be able to structure the data and to query what you need to be able to present to your health board and their members. We want to make sure that there is adequate security and user access. So we have created users who will be limited by the things that they will be able to do to get information in and out of these databases. So we have created 4 unique users and various levels of access have been granted. So Paul will be the database administrator and who will have access and all privileges to the system. Sue will be able to perform database backups in the event that those copies need to be made. And then Joe can actually look up, add, or modify the information, but he will not be able to delete information. And Sam can only access the pre-built views. So these would be people like your office staff who want to go in and see what the latest results are for those patients. So here's some of the sample views that we can create, some of those things that we just talked about with Sam and what he can look at. And you can trend those data, the points of information, graph it, or look at it in a table view, and that's going to depend on you. We just want to make sure you have the data that you need to target these patients to help with their glycemic control. And lastly is just one other view that we were able to pull by gender. And again, we can always tailor the information that you want to pull out of this database, but we definitely want to have you know that we can have the data there for you and provide any database needs that you may have. So thank you very much for today, and we look forward to working with you in the future.